Respiratory. Hi, my name is Amy and I'm a respiratory care student. Today I'm here to help give you a little help with your breathing to help you cough up some secretions, okay? So the first thing before anything, I'm going to also check their ID band, okay? So their ID band checks with my stuff. So I wash my hands, dry them. So today here we have an acapella, okay? And this is just to help you after, especially with when you have like a nebulizer treatment. We want to be able to, after you do that, and we want to be able to help you get those secretions out of your lungs. That way it'll help you to continue to breathe better, okay? So with this, I'm going to demonstrate to you how to take this, and I'm going to always set it at the lowest setting here, so that way, especially for an elderly patient, you want to start out at the lowest. That way you know where their strength is with their lungs. So with this here, I have it set at the lowest setting. We'll start out with that. And what I'm going to have you do every time you take this, I'm going to have you take a big deep breath in. Then when you exhale, I don't want you to exhale forcefully, but I want you to have a good exhale when you go out. So you want to breathe in and then exhale. So every time you do that, I'm going to have you do that 2 to 3 times, and then in between I'm going to have you do 10 to 30 breaths per just to kind of get your lungs back to normal, and then we'll do it again, okay? So I'm going to, and always before I do anything, I always make sure I also listen to like the lungs before I give it, and then that way I kind of have a good feeling of like I can hear anything abnormally that I may hear. All right, so I'm going to give it up to the patient, and I'm going to instruct them and help them along with it, especially for their first few times to get them used to what they are doing. All right, so right now we are going to take a big deep breath in, and when you seal around the mouthpiece here, you want to seal it tight with your lips. You don't want any openings. That way it gives you the best results for you, okay? So when you do that, you want to take a deep breath in. Okay, so we're going to take a deep breath in. I'll go in with you. And then we'll go exhale. And then when we do that, you want to have a 1-to-3 or 1-to-4 IE ratio when the patient is doing it. So you're going to inhale and exhale for at least 3 seconds, 4 seconds. So when I am done, then, all right, so this is a device that we can send home with you. So we're going to keep it in a safety bag for you. After every treatment that we will do this. And when you go home with this, I will help you, and I'll explain to you how to properly do it at home when you take it home with you, okay? So with the acapella, like especially when they're at home, it's good to have them do it every hour, just that way they get used to helping themselves get that rate in, and like be able to exhale and produce the cough that they need to do to help keep their secretions out. Okay, so we have this here, and we will put it into, we have a safety bag here that we'll place it in, okay? Now with these devices, we don't hook up like any nebulizer or anything to the end of it, because with this here, it will start to clot everything. Like the particles from the medication could get stuck in there, and with this machine, you can't take it all apart like anything else to clean it out. So it's good to do it after a treatment, and it's also good to do it before a treatment. That way it can get their airways open, and then that medication can get into their lungs and help them. So we'll place this in here, and then you want to do that for 10 to 20 minutes with the patient, going back and doing the 2 to 3 times, and then taking the 10 to 30 breaths with them, normal breathing, and then do it again. That way they get the most out of the treatment every time they do it. And as always, if I notice if they cough up anything, I need to chart that down. I need to chart down like the color of like what they cough up, if it has any foul smell, odor, anything that could be indication of any infections, anything that else that may be causing problems for the patient to get more secretions. So I always, after I do a treatment, I always want to wash my hands before I leave the patient's room. And then I always want to check everything, always get their vital signs, make sure they are doing okay, their SpO2 is fine before anything, and listen to their lung sounds, see if the treatments are working to their ability. And then after I'm done, as always, chart anything that has happened with the patient, any treatments that I've done, and let the nurses know that I did a treatment for them.